So we'll talk about some very important incisions in surgery, and this is the wide surgical excision and the narrow or local excision, or they call it the conservative excision. So what are the differences between these two types of excisions? So for wide surgical excision, you just have to do it. You can see this now. This one in the middle is narrow. Wide, you can see that the cut is much more wider. Okay. It involves removing the lesion or tumor along with a significant margin of the surrounding health tissue. Purpose is to what? Ensure that everything is cleared and reducing risks of what? Recurrence. Like for example, in cancers, you don't want the cancer to now occur again. You understand? So margin, typical large, often 1 to 2 centimeters or more depending on the tumor type. While for the local excision, or you could say narrow excision or conservative excision, you are trying to remove only the lesion itself. So most of the times you are doing this because you want to preserve tissue, and you know that the lesion, once you remove it, it will not come back. Okay. Purpose is to preserve tissue, prioritize cosmetic and functional outcomes. So margin is usually small, just around the lesion. So downsides, there's higher risks of what? The condition coming back. Do you understand? If some cells are still there and they still contain the condition. So that's it for the differences between a wide surgical excision and also a narrow or local or conservative surgical excision.